Encephalitis is an acute inflammation of the brain, which could be caused either by virus, bacteria, parasites, chemicals, or immune system attacking its own tissue, otherwise known as autoimmune response. Nevertheless, viruses are the most common cause of encephalitis, herpes virus being the most common cause among viruses, followed by Arbovirus, which is spread by ticks and mosquitoes. In case of herpes virus, it is transmitted through direct human contact, and once inside the body, virus travels through nerve fibers and may cause an infection of the brain. Also, virus could undergo a period of latency and become inactive until emotional or physical stress reactivates the virus to cause an infection of the brain. Arboviruses usually are hosted by animals such as birds, pigs, chipmunks, or squirrels that carry the virus, and then virus is transmitted by mosquitoes or ticks which bite humans. Once inside, virus replicates and travels in bloodstream. In cases where there is enough amount of virus, brains could get infected, and that causes encephalitis. It is notable that arboviruses are more common in warmer climates, where mosquitoes are active throughout the whole year. First symptoms of encephalitis are fever and headache, and symptoms usually rapidly worsen and could result in seizures, drowsiness, or loss of consciousness. At first, it may appear similar to flu infection. Encephalitis is rarely life-threatening, but in some rare cases could cause death. This depends on severity of disease and age. Younger people are at lower risk to develop permanent health issues, while older people are at higher risk to develop complications. In severe cases, encephalitis causes damage to the nervous system, resulting in seizures, paralysis, memory loss, and muscle weakness. Damage to the nervous system can be permanent. Whether encephalitis is contagious or not depends on how a person gets infected. Usually, if disease develops due to bite infection, autoimmune response, or chemicals, it will not be contagious. In case of herpes virus, encephalitis could be transmitted from person to person. Since there are many causes for encephalitis, the cure depends on underlying cause. Because it is most commonly caused by viruses, antibiotics usually don't work. However, there are some antiviral drugs to treat the infection, but they don't work for arboviral infections caused by virus transmitted by ticks. Still, to our luck, there are vaccines that prevent this type of encephalitis. But not every cause of encephalitis has a vaccine, and vaccine may not be available in your region. To diagnose encephalitis, doctors usually question patient about their travel history and geographic location, and will do a physical exam to examine whether there are any noticeable insect bites, and most likely will do a blood test, including complete blood count. In some cases, brain imaging, such as magnetic resonance imaging, known as MRI, is performed. This is especially common if the cause of disease is herpes virus. PCR may also be performed to determine whether there is any viral DNA in bodily fluids. There are two types of encephalitis: primary, which starts directly in brain, and secondary encephalitis, which begins with infection in other body part and then spreads to the brain. So, to sum it up, encephalitis is an inflammation caused by many different agents, viruses being the most common. It is rarely life-threatening, but some people sustain permanent damage from it, and in some rare cases, it is fatal. Most importantly, best prevention against encephalitis is, as always, vaccination. This has been Science in Depth, and thank you for watching.